Thank you, sir. Good morning, everyone. There are many different ways of building an OT complex, but the essential principles that should be followed while planning the physical layout are exclusion of contamination with proper traffic patterns and separation of clean from contaminated areas. So the first and foremost thing to consider is the type of construction. Are we going to construct a new building altogether, or are we going to renovate an already existing structure? Is it going to be an exclusively eye hospital or part of a multi-speciality hospital? The next thing to consider is regarding the size of the practice, as this is directly correlated with the number of OTs required and thus with the requirement of the space. Designing an OR is not merely a simple civil engineering work, but it requires a combo effort of all the departments. So make a core design team comprising of senior nurses, electricians, plumbers, administrators, builders, and of course the surgeon, and try to visit as many theatres as possible in your locality to understand what works and what does not, and also to gain from their experience. OR has to be located on the upper levels and in the inner part of the facility to limit dust exposure. Regarding the finances, always set aside a budget and decide its upper and lower limit. Planning has to be done depending on the availability of the funds and space. Decide in the initial phase only if you are planning to offer general anesthesia, as extra space is needed to keep the anesthesia machine and additional design is needed for requisite socket placement, suction and oxygen outlet system. Use materials which are locally available, durable, easy to maintain and resistant to microorganisms. An OT complex comprises of an operation theatre, scrub area, sterilization room, storage room, patient preparation room, changing room and anesthesia recovery room. All these areas are divided into different zones. So what are zones? Zones are areas of varying degrees of sterilization in which bacteriological count decreases from outer to inner zones. Now, the OT complex is basically divided into 4 zones: protective zone, clean zone, aseptic zone, and disposal zone. The protective zone comprises of changing rooms for surgeons and staff, storage area, and transfer base. The clean zone comprises of sterilization area and induction area. Aseptic zone comprises of theatre and the scrub area. Disposal zone comprises of disposal areas from each OT and dirty corridor. So this is how zoning is done, by creating barriers and different levels. It is not mandatory to use stainless steel barriers, and it can be easily done by just employing aluminium panels. And there is no hard and fast rule as to the division of space among different zones. It can be done based on the availability of the space. Better to have separate entry and exit points, one for the patients and other for the doctors and staff. Clean areas should not have any toilets. Toilets should always be before entry to the changing room. OT should preferably be square in shape and should have an area of at least 6 to 6.5 meters square. 3.5 meters of height is sufficient for normal OT, but it should be more than 4.25 meters for convenience of fitting of laminar plenum and HVAC ducting. Doors should be at least 1.2 to 1.5 meters wide for easy patient movement. Doors should be of PUF sandwiched with stainless steel or HPL panels. Ideally, doors should be fitted with vision panels to avoid unnecessary disturbance and staff movement. We can have either sliding type of doors or swinging type of doors, but it is always preferable to have sliding doors, as it saves space and it prevents air turbulence. Ideally, doors should be electrically operated, hermetically sealed to ensure asepsis. Now, walls should be smooth, non-porous, non-reflective and easy to clean. In modular OTs, walls are made up of stainless steel or EGP panels. To make that, initially a framework is laid down which comprises either of brick wall or steel itself, and upon that, on either side, stainless steel or EGP panels are placed, which are then coated with antibacterial paint. The paint should preferably be white in color. Tiles can also be used instead of stainless steel in case of financial constraint. The grouting in the tiles can become dirty and harbor bacteria and fungus. Therefore, care has to be taken to clean the tiles and grout regularly, and if there is any gap, it must be sealed and waterproofed immediately. Floor should be slip resistant, smooth, shiny and impervious with minimum joints. Flooring should be either inset mosaic with copper strips to carry away any static electricity produced, or it can be made anti-static by using PVC roll or epoxy. Ceramic tiles can be used if there is a cost issue. The false ceiling in modular OT is made up of stainless steel backed with calcium or gypsum boards. But in cases of general OTs, either metallic boards or calcium silicate or gypsum boards can be used, which are again coated with antibacterial paint, and it should be once again white in color. The height of the false ceiling should be at least 3 meters from finished floor level. The corners of the room should be coved to prevent dust accumulation. Scrub area should be located immediately outside each theatre. The flooring in this area should essentially be non-slippery, and taps should be either foot pedal operated or elbow operated or infrared sensor operated. The most careful CSSTs are divided into 3 areas: zone of decontamination, sterilization zone, and sterile storage area. In zone of decontamination, primary cleaning of instruments is done. This area should have a negative air pressure so that air does not rush out into other spaces when the doors are open. An easy way to achieve this is by use of a powerful exhaust fan. In sterilization zone, final packing and autoclaving of instruments is done. This zone should have positive air pressure. Now, sterile storage area lies adjacent to the zone of sterilization, and this is used to store the sterile packs and articles. A temperature of 18 to 22 degrees with a humidity of 40% to 50% should be maintained in CSST, and there must be at least 10 to 12 air exchanges in an hour. There must be a provision for storeroom for storing intraocular lenses, less frequently used instruments, spare instruments, scrub dresses, and spare gowns. Ideally, the walls of the storeroom Ideally, the cupboards should be made inside the wall with stainless steel, and shelves are made up of glass. But if this arrangement is not feasible, then cupboards can also be made from slatted metal or terrazzo. The cupboard should start about 30 centimeters from ceiling and finish about 20 centimeters from the floor to avoid dust falling from ceiling and floor landing onto the items. Good lighting is needed in OT. Light should always be flush to the ceiling. The position of operating table has to be decided before placing the sockets so that the equipment can be plugged onto the wall and can also reach the operating table simultaneously. Make sure there are no loose cables lying on the floor to avoid tripping. Always use double sockets with proper earthing fuse box. Keep a provision of generator and UPS in case of power failure. The oxygen and nitrous oxide cylinders must be placed in a separate room with easy access, and fire extinguishers should be placed strategically. Avoid using extension cables inside the OT. Clean filtered water is required for cleaning instruments and for scrubbing, while ordinary tap water can be used for cleaning OR. A separate overhead tank should be provided for OT, which must be cleaned periodically. Now, coming on to the most important aspect of any OT complex, that is air ventilation system. The main purpose of air ventilation system is to control the temperature, pressure, and humidity, and also to dilute airborne bacterial contamination. The current trend is to employ heating, ventilation, and air conditioning system. Now, this HVAC system has an outer air handling unit and an inner laminar airflow plenum. The AHU of HVAC has 3 chambers. The first chamber has provision for entry of return air and fresh air inlet. Air in this chamber is mixed and then passes through a set of 5 microns filter into the second chamber. In the second chamber, the air is cooled, compressed, and then blown at a desired pressure, and then passes through a set of 3 microns filter into the third chamber. From the third chamber, air passes into the airflow plenum via 0.3 microns filter. As per CDC and NABH, a temperature of 21 degrees centigrade and a humidity of 20% to 60% and a positive pressure of 2.5 pascals must be maintained inside the theatre. There must be at least 20 air exchanges in an hour, out of which 4 must be fresh air exchanges. The unique thing about AHU of HVAC is that it is both an air purification and air filtration unit, and there is a provision for fresh air entry, which is not feasible in window ACs and split ACs, as these are purely recirculating units and they have convenient pockets of microbial growth which cannot be sealed. So if there is a financial constraint, do not compromise on air ventilation system. It's better to cut down on other things. To summarize, designing an OT complex seems to be a tough task, but it can be made easy by proper planning and by utilizing resources in a channeled way. Thank you. Have a happy and safe surgery.